Dr. Solomon, welcome to the podcast. I am very excited to have you here. I know you don't know my full backstory, but my son has been through hell and back with what we're going to talk about today, and how it affects the whole family. And I've done some podcasts about his story and his healing journey, but we haven't really talked a whole lot about his disease process and his treatment. So we're going to be talking about inflammatory bowel disease and I always want to say inflammatory, but irritable bowel syndrome and the difference between them. A lot of times people think they're kind of the same thing. It's like, and I'll talk about my son.
Well, they are connected in a unique way, but there are different diagnoses.
Yeah. And they just, a lot of people think they're the same thing. They're like, oh, I have that. It's like, probably,
No.
probably not quite,
Probably
but very similar. They can be similar. So first, just give us a little bit about your backstory and how you even got interested in this and how you got to where you are.
Oh, okay. How back should I go? But I'll go back to where it's relevant. So I come actually from a background of herbal medicine. I studied, my first education was actually in traditional Chinese medicine. And when I finished that studies in Israel, I wanted to specialize in gastroenterology. And then I flew over to China, to Chengdu, and I lived there for a pretty long time, actually. And I was fortunate to be a student there of the head of the gastro department, Dr. Liang Chao from the University Hospital. And that's where I learned a lot about the herbal medicine and the way it can treat not only inflammatory bowel disease, but actually gastrointestinal diseases in general. But what I also realized there is that there is a huge gap between the way that they treat the diseases over there and how we interpret and to treat diseases in the West. So then I put it sort of as a personal mission to bridge that gap and try and take this great knowledge that I learned there into the Western facilities and into the Western community. So when I came back, I went to Sheba Medical Center, which is the largest hospital in Israel, and we founded the integrative medicine unit in the gastro department. And that's where I also met Professor Shimon Ben Cholin, who was the head of the inflammatory bowel disease the unit then. Now he's past 5 years, he's the head of the department. And we sort of met from two different angles in the same place. I came from a background of traditional medicine, herbal medicine. He came back from a background of conventional medicine, but we also both saw the limitations that each of our medicines had and the need to sort of bridge that gap. And that's when we had started working together, and we've been working together ever since, researching and developing natural compounds with evidence base to treat gastrointestinal diseases such as IBD. So what we basically do is take these natural compounds that have known to have therapeutic value and benefit for over the years from traditional medicine, but we take it through the rigorous scientific route. We use them for patients, and then we understand the molecular mechanism, and then we put them through gold standard randomized controlled trials, placebo-controlled trials, to see if they are effective and safe for use. And if they are, we use them, and then we promote them for the uses in our patients. So that's basically how it all began.
Awesome. Well, I'm really excited to talk more about this subject because unfortunately, when my son got very ill with ulcerative colitis, he was just 11 years old, and it was 3 years of trying all kinds of medications. And his pediatric gastroenterologist was open to different therapies, but couldn't provide them for us because the standard of care was very limiting. And it was basically just these tiers of pharmaceuticals to try. And this one didn't work. Then we stack it and we just would keep going until we got to the immunosuppressants. And it was a really hard existence for him. And I'm sure you know this, working with people with Crohn's and colitis. I mean, it's very life altering. And, he was so sick that he was begging me to homeschool. And we went from being super active, healthy to basically ill within a week or two and couldn't figure out. So I was very excited to learn about this. And although my son is doing very well and has been in remission for years, just to have an alternative to try that is evidence-based is very, very exciting for this community. So can you just real quickly tell us the difference between IBD and IBS? Because a lot of times people think they're interchangeable, and I think it's important to distinguish. And then the treatment that we're going to be talking about is useful for both, correct?
Not exactly. It's more effective as from what we see for inflammatory bowel disease. But first of all, I'll explain the difference between them. So inflammatory bowel, we'll start with the other way around. IBS, irritable bowel syndrome, is a diagnosis that is done through elimination. That means a person presents certain gastrointestinal symptoms. It can be diarrhea, bloating, constipation, abdominal pain, any one of these. But then he goes into to do all kinds of workup on him, and everything comes back fine. Nothing's diagnosed. We don't have any objective parameter that can be responsible for those symptoms. That's why it's called a syndrome and not a disease. It's irritable bowel syndrome. On the other hand, inflammatory bowel disease, a person can present with some symptoms. Usually they're more distinct, but then we have a conclusive objective diagnosis done through colonoscopy, where we can obviously see and measure the inflammatory process, and those are specific kinds of diagnosis. So very separate, very different, but basically speaking, within inflammatory bowel disease, we have ulcerative colitis and Crohn's disease, which are pretty much like 98% of inflammatory bowel disease are either one of those. And then we have some other microscopic colitis diagnoses, which are much more rare. But basically, that's the difference. And we've been focusing mostly on inflammatory bowel disease, actually, because as you said, it's a huge burden on patients. It's just really debilitating, and the huge effect on quality of life. Especially, it's a diagnosis which happens at a younger age, usually between age of 15 and 25, or between 20 and 30. So young people, as you said, very active, and then all of a sudden they have this condition that really deprives them of a lot of the activity that they like to do. And the treatment for current pharmaceutical treatment is just far from being as effective as we'd want to. This is not just an opinion. These are facts. We know that the therapeutic ceiling for most of the pharmaceutical treatments for ulcerative colitis don't even reach higher than 30%. That means that 70% of our ulcerative colitis patients are left with active disease. They can't achieve remission. And that's just a huge unmet need, and we had to be addressed. So that's what we focused on with our first research and development of the natural compounds.
Yeah. And how I learned about you was basically when my son got sick. Moms are on a mission. Kids have autoimmune disease. I mean, that's actually how I got into this space. I went down every rabbit hole that could be triggering him, and met all of these moms who had kids with either Crohn's or colitis. And they were very smart women, like I said, on the mission to get their children well. And although my son has been in remission for several years, a lot of these kids were still struggling. Like you said, I mean, they just failed therapy after therapy, and their quality of life. I mean, my son's growth was stunted. He was super skinny. He was made fun of. He wanted to be homeschooled despite, having a lot of friends and being very active prior to getting ill. But this mom group was literally my lifeline, and how I found out about you and the therapy that you have worked on. And I have known many people to use the regimen and have very positive outcomes because of it. I mean, things that were not achievable for years and years on pharmaceuticals. So tell us a little bit about what you've been working on, what you developed, and what it's used for.
Okay, so in a broader sense, if I zoom out and say that what we wanted to do is really have another treatment option for these patients that we can fully stand behind, that we have sufficient evidence to support its use and make it available and accessible for patients through mainstream medicine. This is not something that you have to go to some far off. We really want it to be accessible through mainstream medicine. The only way to do that is to have strong evidence, scientific evidence to support it. So the way we did it, we started out researching a compound that was derived from curcumin, which is a very popular and well-known compound. You can get, dozens of different brands online and so on. But there's good scientific evidence to support its use for some medical indications. But in inflammatory bowel disease, there wasn't really anything that was strong enough. So we developed a specific kind of curcumin that is gut directed. We use it that it reaches high concentrations, specifically in the intestinal mucosa. So that's where the disease is active in ulcerative colitis and with limited systemic absorption. So it's direct to target treatment. And then we said, okay, we used it in the clinic. We saw at Sheba Medical Center, saw good results, say, okay, this is promising enough. Let's take it into the clinical trial. And then we did a randomized control trial, placebo-controlled trial, and that showed it to be very effective for patients that were failing pharmaceutical treatments. These patients were on maximum medication, first-line medication. They were still failing it. They had active disease, supposed to go into second-line therapy, which is the immune suppressants and the biologics and medications that have considerable side effects. And that's when we added on this form of curcumin to their treatment. And many of them were able to achieve remission, sparing them that escalation into second-line treatment. So that was exactly the kind of unmet need that we wanted to address. Let's take these patients. We don't even have to substitute their medical treatment. We just add this treatment onto that. And then we have a dual treatment that achieves remission in many cases. So that was something that was published in one of the world leading gastro journals in 2015. And after that, we started developing what is now really sort of our claim of fame in that sense, because it's really revolutionary in that sense. We scored a combination of two herbal compounds, one of them being the curcumin, we combined them together in a specific protocol, dose-dependent protocol, and that was suitable also for moderate severe disease. And when we started using these two, this is a compound that we call it QD. I introduced it from one of my colleagues in the Far East when I was working with them. And when we started using this in the clinic, this was a whole different ballgame. This is something that showed exceptional results, very rapid results sometimes within days, even with severe patients. And after using it for a while, I called Shimon up and said, listen, I got something interesting. I need another set of eyes on this. And then we started looking it together, started gaining more experience, and eventually thought, okay, this is really promising. We need to go into a placebo-controlled trial to really prove it to be effective and safe, and then we can sort of spread the word out. So we did that. We managed to do from 2020 to 2022 a randomized control trial, which was done in two different centers, one in Israel, one in Europe, with moderate severely active ulcerative colitis patients. These are patients that half of them were failing biologics and were on the strongest medications conventional medicine had to offer, and we're still having moderate to severe active disease. We added on the combination of these two compounds, and we showed very high rates of both clinical and objective endoscopic remission. And that was, to be honest, that was insane. We showed a lot of our colleagues around the world, when you show these results to them, their jaw just, drops. Because this is something that we don't see even with really the strongest medications that we have. We don't see these kind of results with these super refractory patients. And that's when we founded EviNature, which is actually a spin-off company of our hospital. EviNature, the Evi comes from evidence, because that's exactly what we would do. Wanted to combine natural medicine with enough scientific evidence that could really have something that we could spread the word about and be supported enough, be confident that this is another therapeutic tool that we can provide to patients. And that's what we did. And this is now really gaining so much support through medical leaders, from leading IBD physicians in the United States and around the world. We're working continuously with them. They're referring patients to us, some of them very severely active. To just recently received 2 cases from a leading IBD center here in the United States that were actually on the verge of colectomy. And this was sort of a last resort for them. The head of the IBD unit at that center referred them, and they were both achieved remission and are actually able to keep their colon now because of this treatment. So this is something that is gaining a lot. We already have over 5,000 patients that we are being treated in the United States using this compound. So this is really so fortunate for us because it's become sort of a standard of care among IBD centers in Israel. But through Evi Nature, we managed to bring this out to the world, mostly into the United States, but all over the world. We have patients in Australia and Europe and pretty much everywhere you can think of where there are IBD patients we've had some experience with.
Yeah, I can attest to everything that you're saying. We went through this, and the baseline kind of medications are somewhat affordable, don't have a lot of side effects, but then you fail those and you start moving up in the tiers and you're on steroids for months on end, and maybe you feel a little bit better, but you're not achieving full remission. Your bones are getting brittle, you're not growing. I mean, and for us, it was our child. It's like, I just wanted to be in his place, like, this is so terrible. And to live with somebody with these diseases is awful. But then you just keep moving on up, and then you're into the immunosuppressants, which are suppressing the immune system. I know the one that we were working with, it was classified as a chemotherapy. Scary stuff. It seemed to actually make my son more ill, and they're very, very expensive. So it's like the affordability of it is crazy too. So I just hope, do you see this being in the standard of care in the United States? I know you talked.
Absolutely.
Oh, that
absolutely.
fabulous.
That's definitely our aim. I'll tell you a unique story just of how, sometimes, modern medicine has an interesting way of working. Actually, one of the moms, we discussed, we're not going to say names obviously now, but one of the moms that you work with, her son was very refractory case of ulcerative colitis. He was actually treated within failing 2 biologics when his mother found us and reached out, and we treated him with the protocol. And he achieved not only clinical remission, but also objective remission through intestinal ultrasound, which is a way that is now used, another clinical diagnostic way that we use on IBD patients. And what was interesting is that his physician, which again, we're not going to say names, but she's a leading pediatric IBD doctor in the West Coast. She actually tweeted the results of the results with the consent, of course, from the mother, and she showed the 2 pictures of the intestinal ultrasound that she did, and she said that she wouldn't have believed it had she not done the test herself. And actually, through that patient, she got in contact with us. She's an amazing doctor, really devoted to her patients, and open-minded. And he said, "This is just incredible." And now we're doing scientific research together with her, promoting this for patients. And she's actually submitting now to the upcoming Crohn's and Colitis Foundation conference. She's submitting an abstract of patients that she treated, pediatric IBD patients that she treated successfully using this protocol, this CurQD protocol. So that's sort of building the roots, building everything from bottom up. Okay, patients are going to have good experience. Doctors are going to have good experience with it. And then slowly, it'll just build up. That's the way it happened in Israel. And that's the way we see it happening in the US as well. It's going to build up from the bottom up, and patients are going to say, listen, we want another treatment option. Doctors are saying we want another treatment option for our patients. And then eventually I see other sectors that are more sort of the background and the sector around these also coming into the game, seeing like, wait, the medications are too expensive. They're inaccessible for a lot of the population. This is something that is much more affordable. It's safe. How can we make it accessible for our patients? So yes, I do see it becoming part of standard clinical care. Obviously, there are a lot of barriers in between. Let's be honest about it. There are regulation barriers. There are financial barriers that have to do with it. That come from how the system works. But we're not going to stop until it's there, and we have a tendency to be very very proactive and very, very persistent. So yeah, we'll get there.
Yeah, my son's gastroenterologist was a very kind man. I mean, he wanted his patients to feel better and very, very gentle nature, but his hands were tied. Like he could only offer what was in the standard of care. And of course, I'm digging all this research up and working with the mom you're speaking of. And she's, like there's like 5 or 6 moms digging up all this research, but, anything alternative that we would ask about, he didn't know much about, but also what was not comfortable with prescribing anything or implementing anything because it
Oh,
wasn't standard.
listen, I have full respect. This we have to understand we're doctors and clinicians ourselves at Every Nature, so we fully respect the fact that a doctor, having studied so many years of medicine, and it knows one way, knows about the pharmaceuticals, and then there's, as you said, his hands are sometimes tied. Even if he sees something that can work for his patients, he might not be able to get to prescribe it in the same way. So, and it's disruptive what we're doing. It is, and we can respect a lot of doctors very devoted to their patients. They want their patients to get better, but it's difficult. We need to find ways to get around these barriers. Sorry, a call coming in. So we have to really make this accessible. So even these doctors, once they get their experience they can find a way. We have to work together to just make this and offer this to patients.
And even if you're not, like if you want to try this protocol, like say your doctor didn't support it, you can just go and order it off your website.
Yes.
Yeah.
Yes. The advantage with, okay, again, we'll back up and then zoom in. Our protocol, which is called CurQD protocol, and because it's a combination of these two compounds, is regulated as a food supplement. Okay, which makes it very accessible in general, and it can be used. We can use a direct to patient approach. Patients go online. It's really easy. It's just everynature.com. That's EVI nature in one word.com. They can go online, take an online assessment, which uses validated disease indexes that we use in the clinical trials as well. And according to their answers, they'll be recommended the appropriate protocol for their use. And then they're followed up after 6 weeks with another follow-up assessment, and then we continue treating them according to their response to the treatment. So it's very much tailored to what they need. So that's a direct to patient approach, and you don't really need a prescription from a doctor. But in parallel to that, we also have collaborations with over 25 leading medical centers in the United States that we work together in order for them to have a referral process from the medical centers in themselves that will help them generate this real world knowledge and experience with patients. So we can get it, as you said, to be part of the medical system. It's not enough for us to be only direct to patient approach. It's not enough for us just to do these academic research that will be published in medical journals. I mean, that's great to get the word out, but that's not the aim. The aim is to treat patients. So combine those two together, and using an online platform, which is, just a sign of the times, I guess, especially since COVID, where everything sort of went online again. So when combining those three platforms together is really what makes it so effective.
Yeah, I think we had my son's protocol ordered in about 5 minutes. It was really easy, and it came within a week. And he now works, because he's 18, but he has worked with an integrative doctor for several years. So she knew about the protocol that we were ordering, and I told her about it, and, made sure she was fully aware of just another option. So it worked really well. And if I remember right, like I'm a registered dietitian, they can also refer, like there was a link for registered dietitians also.
That dietitians can refer. Yeah, absolutely. Yeah. Absolutely. We welcome these kind of collaborations with any kind of medical professionals, whether it be a medical doctor or a dietitian or a naturopath or a herbalist or whatever. We welcome all of these because again, coming from a background of these traditional medicine, there's a lot of advantages to that. But I was sort of, to be honest, I was a bit disillusioned from part of it, because some of it is just not, it's just knowledge that came down from ancient times, but it's just not integrated well into modern medicine. And it has to be. So that's what we have our leg in both medicines right now. So we welcome dietitians or herbalists for any kind. Okay, listen, use these tools, but use it right, use it correctly. You have to have the right dose, you have to have the right compounds, you have to use it for the right indication. I mean, using, for instance, the CurQD protocol that we use, using it for IBS is not going to be effective. Okay, it's not for that indication. And for other indications for ulcerative colitis, it depends on what your condition is. Some patients have a mild disease, sometimes have a severe one. You can't use the same treatment. It's not one size fits all. Okay, it has to be tailored. So there's a lot of know-how, a lot of research, and a lot of experience that we poured into this in order to make it what it is today.
Yeah, that's an important point to reiterate, because IBD is, the severity is happening at the mucosal layer, whereas IBS is different. So yeah, you're completely right. Like, it's working at the mucosal to heal the mucosal layer, which can happen pretty quickly because that turns over so fast. But yeah, I had a very good friend of mine who had suffered from UC for many months, years. I mean, she had done everything. She's in the nutrition field herself, so she had looked up everything alternative. She'd even gone to Chicago to get stem cells. She was failing biologics. She did every diet known under the sun. She even did carnivore for a couple of months with absolutely very little difference made. And I told her about this, and she's like, well, I'm on my way to colectomy. And actually, when you're that ill, a colectomy doesn't sound so bad. And I remember when my son was hospitalized and he was having 20 plus bowel movements a day, I came to peace with him. You know, if it came to having a colectomy and losing his colon, at least he'd have some quality of life. So she was to this point, and I told her about it, and she ordered it right away. And she's like, I cannot believe this. Like, within 2 weeks, bleeding stopped, cramping stopped, her quality of life completely improved. I think she just did one round, because it's a 6-week regimen, one regimen.
Yeah.
I don't even think she's done a maintenance. So can you talk about that a
Well,
little?
I hope she will, because that's important.
I'll have to
Cut into
encourage
Rob.
it too. And I could be wrong
Yeah,
on that, but I feel like she, like, she's just doing so well and is so amazed at it. But is it something that you do just one time? Does it depend on the severity of the disease?
no,
And
that's exactly what I'm saying. When the very high effectiveness of this treatment, as you said, sometimes really works really fast on these really severe patients. Sometimes that's actually a disadvantage. Why? Because people look at it sort of this miracle pill, and it's not. It's not a miracle pill. We're not magicians. We're doctors, okay? And we have a treatment that is very effective, but it's not going to be a magical pill that you take it once and from this super severe condition, you're going to be in remission. That's it. You're cured. And no, it doesn't work like that. We have to be honest about how it should be, and it should be followed up. So yes, the protocols are a 6-week protocol. The reason we did it for 6 weeks is that that's the time point from our experience where you know if it's a go, no go. If you respond within 6 weeks, you got to keep going. Do the follow-up assessment, because maybe you'll receive a different protocol for the second time. It'll still be a 6-week protocol, but it's a different one that is tailored for your condition. But if you don't respond clinically at all within 6 weeks, stop. Don't continue. It's not working for you. This is not a miracle pill. It's not going to work for 100% of the patients. Nothing works for 100% of the patients. If you ever hear someone saying, come over, I've got something that have 100% cure rate, just turn your back and walk away. Okay. This is not real. We have very high efficacy rates, but it's not 100%. And if you don't see that by the end of 6 weeks, it's probably best to either contact our clinical support and ask, what should I do? But usually at that point, we say, okay, just time out. It's not working. Let's look at other options. But if she did respond, then definitely go back, do the follow-up assessment, because this has to be continued into maintenance. And then for continuing maintenance, you have to have a lower protocol and just keep on that over time.
okay, good to know. So can you talk about relapse a little bit? If somebody did the protocol, it was effective, for whatever reason, they stopped doing it, went into relapse. Has it been shown to be somewhat effective with relapse
Oh
again?
yeah, absolutely. That's exactly how we do it. So we have this. We have a lot of data coming in from Israel, from patients we've been treating for years. We started using this in the clinic in Israel around 2016. So we have a lot. First of all, we have a lot of patients. Second of all, we have patients who've been on it for a long time. Obviously, tapering down and sort of using different protocols. But we've had patients that have been on it for over 6 years now. So one good example is one of the first patients we treated in the hospital. She was a very severe patient. She was failing pharmaceutical treatment that she received. And then her doctor prescribed her a biologic and said, listen, while you're waiting for sort of the reimbursement process, the approval process, why don't you start CurQD and go with that? And she did. And she responded, as you said, very quickly. A lot of these patients respond very fast. So within 2 weeks, she's practically in clinical remission. But we don't open champagnes just yet. We say, okay, let's look at. We're happy you're feeling better, but let's wait a while, see if it persists, and it did. And then we scoped her again. We did a follow-up sigmoidoscopy after 6 weeks. We saw marked improvement in her condition. So we said, okay, let's keep going very gradually, and then scoped her again after I believe it was 3 months or so. She was in complete mucosal healing, and actually that patient is still on the CurQD today as a maintenance protocol, never escalating to that biologic. We're already, like 6 years later now. So yes, and it is very effective for maintenance of remission. That patient specifically did have 2 very small relapses within that 6 years, very small ones, not anything severe. And all we did was sort of reinduce a higher protocol, okay, to take care of that flare, get her back into remission, and then taper down again to that. But these were very minor flares in her condition, which a lot of times happened. We can't, people, life isn't sterile in that sense. People have stressful periods in their lives. They can go traveling and have an opportunistic infection, which can trigger their IBD. All kinds of things can happen. So we can't just say, okay, you're going to be in remission for forever. That's it. You're cured. It's not something that's possible. So we do that. And just if something happens, we always encourage patients, just get in contact with us. That's what clinical support's for. Just get in contact. We do, and we'll walk you through it.
That is super promising, because a lot of the treatments in the IBD world, you're just kind of taught ride it out as long as you can, because it's going to have diminishing effects at some point.
No.
So usually it's okay, you're going to stay on this medication as long as it's working, and then you're just adding more. So I just
we don't see that. We don't see that with CurQD, to be honest. My theory, and again, I take this with a grain of salt because it's a sort of a theory, is that our body is more accustomed to natural compounds than it is to pharmaceuticals, which are synthetic or chemical in that sense. Eventually, our body or immune system sort of reacts or adapts to a pharmaceutical in a way that it looks at it as sort of a foreign body invading invading the body. So it has to adjust to it. And when you use natural compounds, it doesn't really happen. I don't see anyone that's been on this treatment with CurQD and sort of the body got used to it in that sense. Sometimes there are flares that come out that are not the same as a former flare, and then it has to be reduced, and they don't respond exactly the same. But I haven't seen anyone whose body has adapted and they had a loss of response to it. It just doesn't work that way. But again, taken with a grain of salt, it's more of a theory than something I can back up with scientific evidence.
No, that makes total sense. And I know my son had been in remission for a year and a half, then contracted COVID, and had been on all the medications. And just like you said, sometimes it's just those viruses or, that disruption in the gut, and that triggered a flare. It wasn't long lived.
We saw so many of those, unfortunately, during COVID, for sure.
Yeah, nasty. Well, a couple more questions. I want to be respectful of your time, but what about diet? Does that play do you have anything specific that you're recommending during the regimen? I mean, we talk a lot about eating whole foods and getting inflammatory foods out of the diet on this podcast, because we're trying to reduce inflammation, and we're really focusing on reversing insulin resistance and blood sugar issues. But are we looking at kind of the same thing when we're doing the regimen? I mean, Okay, so I I went down every rabbit hole with all the diets, with like the specific carbohydrate diet. I mean, we don't have time to go into all of that. And we tried those things and they would reduce the inflammation a little bit, but there was never like total mucosal healing. The inflammation markers would get a little bit better. But is there anything in particular that you're recommending for diet?
It's a great question. And there's a lot of evidence coming out about dietary therapy for inflammatory bowel disease. But again, like everything in medicine, it's not one size fits all. So there's no one diet that's going to be right for everyone. As you said, there are people that go vegan, and then there are people that go the other way around for a ketonic diet, which is pretty much the opposite. And I've seen people get better with this and with that. And the problem is that once someone does these things, like, okay, if it worked for me, it's going to work for everyone, and that's just not the case. What do we do know about that? We know that there are pro-inflammatory, or let's say not pro-inflammatory, but that they burden the disease, and that's processed foods. For ulcerative colitis, it's intake of high quantities of meat, of red meat, stuff like that. Sometimes dairy products. Those are the things that we know that are bad for most IBD patients. Other than that, there's been good research considered especially for diet in Crohn's disease, such as the Crohn's disease elimination diet, the CDED diet, which has been proven effective for inducing remission in a lot of patients. So there's a lot of data out there that can be supportive. Usually what we recommend to patients is to go see an IBD dietitian, because it's just a general dietitian might not be knowledgeable enough in these dietary strategies for IBD. So you want to go see an IBD dietitian to get the information you need. I know that in the United States, it's not as popular, unfortunately. I wish it was more so. Which the more patients can have access to good dietitians that could help them with this, but hopefully that will change in the future. So, but we do this. And also you have to know that diet has to change depending on your condition. The right diet for a state of flare is not the right diet for maintaining remission over time. So that's why it really needs, as in any treatment, there's no simple answer. It has to be followed up by a professional that really knows how to guide you through it.
Yes, I talk about that all the time. Nutrition is very gray.
Yeah. Unfortunately, there's no easy answer. I wish it was that simple. Like,
Yes.
yeah, just eat broccoli and you'll be fine.
Yeah.
No.
I am comfortable with saying whole foods, like get rid of the
Oh yeah.
like that. At least I think we could all agree on. But yes, I mean, some people do very well with a certain protocol and others not so much. So I did have a couple people who are struggling with inflammatory bowel ask about using this therapy, the CurQD, in conjunction with either antibiotic therapy or the immunosuppressant therapy. Is it safe to use with all? And I know it's going to be individual. You're going to want to consult with your physician or whoever you're working with. But can you give us some guidance on that?
Yeah. First of all, again, it's a great question that we get a lot, and it's really important to address. Thank you. Basically, from our experience and from our clinical trials, CurQD is safe to take with all IBD related medications. You haven't seen any medication that it's not, whether we've had some interaction between the pharmaceutical and the natural and the CurQD protocol. Having said that, sometimes, especially I'll take the easy example, antibiotics are usually just a very short-term treatment. Okay, you got meningitis or whatever, you take for 5, 7, maybe 10 days. Okay. Sometimes these antibiotics have side effects by themselves, and it can be, not long-term side effects, but diarrhea or abdominal pain that some of these antibiotics do. So usually in that case, we recommend, okay, if you're taking antibiotics, maybe stop with the CurQD for those 5, 7, 10 days. It's not going to make a huge difference, but it may just, reduce the burden on the digestive system and on the body. So that's easy. But with these medications that sometimes you have to take long term, so again, we haven't seen any contraindications with them, but some of these medications, especially the new small molecules such as Rinvoq, have a lot of contraindications by themselves. I mean, they have these side effects, some of them very severe. So in those cases, we always say you need to be followed up very strictly with your doctor and report any kind of side effects that you feel, because they can be related to the pharmaceutical treatment and not to an interaction between the two treatments that you're taking. And they have to be diagnosed that way. So it's more complex in that sense. But as a general answer, yes, you can take this treatment as an added on, as an adjunct therapy to any IBD medication. But having said that, I have to be very cautious about it. It has to be followed up by your medical doctor. Okay, it has to be followed up. He has to know exactly if you experience any kind of side effect, report directly to your physician, to our clinical support, so we can walk you through and see what's the best way to move forward.
Excellent. So last question, I want to make sure to touch on IBS, or the irritable bowel syndrome, just a little bit. I know that can just kind of seem like a blanket, a blanket of cluster of symptoms that people suffer from for a really long time. And the root cause can be so many different things, from food sensitivities to, exposure to chemicals or toxins. But would they go about the same, I don't want to say protocol, but go to your website, take the quiz. The treatments are not the same as the
not the same,
but they would go about
the same
way.
For sure. No, definitely go on to the online assessment. You're going to be asked if you've been diagnosed with one of these. If you're diagnosed with irritable bowel syndrome, go to that. You'll be asked the right directions and recommended the appropriate treatment that we have, which is, it might be different than what we give IBD, of course, but that's it. We actually have now a herbal combination that we've developed that is in the midst of a phase 2 trial right now in Sheba, but it's already available on our website because we have the phase 1 results, and it's very effective actually for our IBS patients. So definitely something that we can use. We focus on our discussion now more on IBD, but definitely if you're diagnosed with IBS, go to everynature.com, go through the assessment. We have some available options for you.
Yeah, because that can just be one more thing that's coming in the way of weight loss resistance. We talk about that in the podcast. And, if that's causing inflammation in the body and, standing in the way of healing, and you've been having symptoms. I mean, I know people who have been having symptoms for decades and they don't know what it is. And, they just learn to live with it, and it becomes common. It's normal, but it's common. So
IBS is really frustrating, not only for patients, but also for doctors, because he just don't have anything to offer. And patients keeps coming back, he's suffering. And you say, well, we just don't have anything to give you. So keep on looking. There are options out there. Okay. Just have to find the right fit.
Well, this has been a really enlightening conversation. We'll link all of what we talked about in the show notes, but is the best way to get in touch with you or those working alongside you to go to the website and go from there? Do you have social media following that we can link?
Yes, there's also tons. You can just try Every Nature on different social medias. You'll find a way there. You can contact us in multiple directions, and we really have a very strong, dedicated team of people helping. So it's actually a big part of the company. We put a lot of emphasis on the clinical support because we really want each patient to be directed and be the focus that we have. So yeah, reach out in any way and we'll try to help the best we can.
Yeah, your clinical support is really awesome, because I had a question when my son was on the protocol and I had an answer within a couple of hours, and very
great to hear.
People working behind the scenes. So thank you for all the work you're doing. I mean, you're literally changing lives and getting people back to a state of health from, being homebound basically and not wanting to live life and feeling like they don't have much to live for in a lot of circumstances. So I love that we found you and that we found your work and that everything is so accessible and available. So thanks for your time today.
Thanks for having me. It's been a pleasure.